Dr. Robert Pendergrast has a new book out about breast cancer to reduce your risk with foods you love. So, ladies, tweet your girlfriends and tell them to listen up right now because you can eat your way to health. And Dr. Pendergrast, welcome to the Bill Cunningham Show. Robert, how are you?
I'm doing well, thanks. And you, Bill?
Great. You make a good point about when a girl begins puberty, is the best time to put soy in the girl's diet to prevent cancer later in life. Well, why soy?
Well, soy has been shown in multiple studies to be associated with decreased risk of breast cancer, primarily when you look at the difference between the way women in East Asia, say Japan, Korea, eat and the way Americans eat. There's clearly a difference in breast cancer prevalence in those areas, and when you look at families who then emigrate from those areas to the United States, that difference disappears within a generation.
So soy is a key component of Eastern women not getting breast cancer, in your view?
Yes. I think the data support that, absolutely.
Why is breast cancer so prevalent today? It looks to me, and this is an amateur speaking, that breast cancer is more prevalent today than ever before.
Well, I think so. And if you had to explain some of the reasons for that, it really gets to the points that I make in my book about prevention. Is that we know, for example, that for breast cancer, obesity is a risk factor. It's clear that increased weight over the lifespan increases risk of breast cancer. Lack of physical activity is a risk for breast cancer. And actually, alcohol intake is a risk for breast cancer. And all of those are fairly prevalent in American society right now, perhaps more so than ever, especially the weight issues. I do want to emphasize, though, that when I'm talking about this, it's important for women not to feel that somehow I'm blaming it on them, that this is my fault. We know that there are risk factors, but there's not a one-to-one correlation between any single risk factor and any individual. All I'm emphasizing is that women can move themselves out of a known high-risk group into a known low-risk group to minimize their chances.
When I've done this topic over the years, I always ask experts such as you relative to cancer. Could there be many environmental factors, such as growth hormones in cows?
Absolutely.
Insecticides on fruits and vegetables?
Yes, sir. And I actually have chapters in my book about pesticides on fruits and vegetables, about growth hormones that are added to milk and meat. And I believe there's good science that backs up your assertion that those are, in fact, a risk. And I think women need to be alerted to that.
I'm told things such as plastic bottles, such as flame retardants, on couches and chairs where babies lie or where young people lie, maybe airplanes in the air, maybe microwaves, maybe cell phones. Does all that contribute something?
Well, I know about the plastic. We know that plastic acts as what's called a xenoestrogen, meaning it's a compound that has no relation to normal human life, but when it gets into the body, it stimulates estrogen receptors, which can promote the growth of tumors. So I'm encouraging my patients and actually friends and family to avoid eating out of plastic containers, to avoid cooking in plastic, because I think we've got good evidence that plastic has that same effect that pesticides could have, for example.
What about water in bottles that are plastic?
Yes, I'm concerned about that, and I've actually changed my water bottle to a metal water bottle with a screw-on lid, and I don't buy plastic bottled water.
What are 3 or 4 things a woman should eat, and then 3 or 4 things a woman should not eat?
Well, we've already mentioned soy. I believe soy is an excellent strategy, particularly for younger women and premenopausal women, making sure that it's natural, whole food soy instead of soy in pills or powders. So I want to emphasize things like tofu and edamame, for example, soy milk without a lot of additives or sugar. The next would be broccoli and other cruciferous vegetables in the same family, including things like cabbage and bok choy and Brussels sprouts and kale. Those have very specific known anti-cancer properties, and especially for breast cancer. Another would be fish, especially fatty fish like Alaskan salmon, rainbow trout, sardines, because higher levels of omega-3 oils in the body have been associated with decreased cancer risk of the breast. And flax seeds. I think I'm already exceeding the number you asked me about. Flax seeds. Flax seeds are those little tiny seeds you can buy in the health food store. A tablespoon or 2 of ground flax seeds a day seems to have a protective effect as well.
So you are what you eat, said a wise old man. If that's true, I'm nothing but a garbage can.
Oh, well, I should hope not.
All right, now what are the things you should avoid? Tell my producer, Russ Jackson, the things you should avoid.
Avoiding. So I mentioned already alcohol. Now, this gets to be a touchy subject because most of us enjoy some alcohol from time to time, but there doesn't seem to be a floor. There doesn't seem to be a threshold for increased risk of breast cancer for women who drink alcohol. So, for example, we know that 5 drinks per week, which would not be unreasonable, I think that's moderate use, actually increases risk of breast cancer in women by 5%, which is actually a fairly minimal increase, but I think women need to know that and be able to make their own decisions. Higher rates of alcohol intake, say 2 drinks a day, increases risk of breast cancer by 40%, which shocks a lot of women.
Say that again, 2 drinks a day is 40%.
40%, not having a 40% risk of breast cancer, but it increases your risk from baseline by 40%, meaning 13 per 100 at baseline would get breast cancer in American women. It would be 18 per 100 among women who have 2 drinks a day habitually.
What about, I always heard that red wine is a good thing. I know many women drink red wine because they're told it's good for them.
And I think that's actually true, but I would be very careful not to drink it excessively. So the red wine issue, I think I could accept that and not be concerned. Another food to really be concerned about would be meats that are cooked, charred, or very hot on the grill, because we know that charred meats, such as a well-done steak, for example, is going to have chemical compounds in it which are known carcinogens that are going to increase risk of breast cancer. So I'm looking to avoid those. And then the final food that I would make sure that women avoid would be trans fats. They have been rightly villainized in our national consciousness. We need to be reading labels and avoid any labeled food that has the word hydrogenated or partially hydrogenated oils on it, because I think we have good data that supports that as a major risk.
Cancer is more prevalent today, in your viewpoint, because of all those reasons that women today are more at risk than their grandmothers were 70 years ago.
I believe so, for all those reasons. Yes, sir.
But then on the other hand, the treatment of breast cancer is better than it's ever been.
And that's something to give thanks for. I really am grateful for that. I work closely with the oncologists here in my community, and they appreciate and respect my work as well as much as I respect theirs. It's important for women to hear that by my advocating nutrition as preventive, by no means does it suggest that I would advocate foregoing any conventional treatment for a woman who's diagnosed. It's important to follow the advice of your oncologist, the surgeon, and learn about nutrition. It's so important that we do that in addition to any conventional therapy.
So stay off the sauce. Don't drink water out of plastic bottles. Take more natural, especially leafy green stuff. Stay away from the charcoal, pork chops, and the steaks. You'll live a happy, long life.
I think that's a good suggestion.
Dr. Robert Pendergrast, do you have any questions for me?
Questions for you?
Yeah, you have a question for me.
Oh, well, I'm just hopeful that a lot of people are out there listening and are interested in this information. I'm on a mission. I want to make this. I want to make a difference. I think we can save 73,000 lives a year based on the data that I've seen out there if women will get on the program and learn what they need to learn here.
Well, based upon this, even though I'm not a woman, I will never again drink water from a plastic bottle. You're telling me not to do that as a man, too, correct?
I appreciate that, sir.
And don't get well-done steaks, and stay off the sauce. And what about dark chocolate? I love dark chocolate. What about that?
I'm a big fan of dark chocolate, too. So I think a couple of ounces several times a week is fine. I have no problem with that as long as it's above 70% cocoa content. That's what you need to look for.
What about a Blizzard from Dairy Queen?
I'd have a problem with that because it's going to raise your blood sugar, raise insulin levels, raise levels of a hormone in the body called IGF-1, and those all promote tumor growth.
So I should not have a Blizzard from Dairy Queen.
Go with the dark chocolate and maybe some walnuts along with your cup of soy milk.
All right. Well, Dr. Robert Pendergrast, the book is a great read and a lot of good comments from Dr. Andrew Weil. I've had him on a couple times. And the book is called Breast Cancer, Reduce Your Risk with Foods You Love. And Dr. Pendergrast, you're a great American, and thanks for coming on the Bill Cunningham Show.
It's my pleasure. Thank you for inviting me.
God bless you.